Welcome to the MS&Me Radio Network, a division of the Multiple Sclerosis Global Support Network. The following program broadcast is an original creation by the broadcast entity. Discussion within the following broadcast should be used for informational purposes only and is not a substitute for professional medical advice or consultation. Before considering application of any broadcast content in the following program, please consult your healthcare provider. If you feel you are having a medical emergency, please contact your local health services for immediate assistance. MS&Me Media and the Multiple Sclerosis Global Support Network do not guarantee or warrant the accuracy of information in the broadcast to follow. The Multiple Sclerosis Global Support Network provisions broadcast services to program hosts. Information discussed in the broadcast does not necessarily reflect the views, opinions, or goals of the network and are solely those of the show broadcast host. Should you wish to host a broadcast, please visit our website at msmemedia.com and submit a request to become a program host. We thank you for listening to the MS&Me Radio Network. Enjoy the show. Get ready for Ask MS&Me. Have an MS-related question you want answered by your fellow MSers? Use hashtag AskMSME on any of your social media accounts, and we'll get as many answered as possible. Get ready. Here comes Ask MS&Me.
Sure. Our first question comes from the Hub, the Information Hub.
Okay. All right.
So I have a question I have been thinking about. What is the age do people with MS usually pass away? Do we not live as long as others?
Oh, good question. A lot of people have that one.
Good question. I have a long answer. I'll try to skim it down as much as I can.
Okay.
You will hear many things quoted by many people. They like to call it a normal lifespan to make it less scary, and actual long-term studies, members over 60 years, show that it 14 years less on average. However, with modern medication, has been cut to the average of 7 to 9 years less. That is still a long life, hence the quote, average lifespan. Survival rates have those with MS have increased since the analysis began in 1953, as have rates among everyone else, making researchers wonder whether the gap in survival between MS and the general population has changed over time. In general, people with MS live 7 to 14 years less than others. Among MS patients, women have higher mortality rates than men. Though their disease progression is slower, their lifespan is longer. Expectancy is longer. Furthermore, patients with primary progressive multiple sclerosis, about 10% of all MS patients, have higher mortality than patients with relapsing remitting forms of initially diagnosed about 85% of the patients.
Okay. That was a very good study. I remember that one. That was the one done over the years, correct? And
yes.
The results showed mainly, like he said, that the median life expectancy was lower for MS patients, which is 74.7 years. So basically, although when the study, if you read the whole study over the 60 years, it used to be 14 years less, which was incorrectly reported, in past years. They would say, oh, it's about 7 to 9 years less. No, it was actually the actual number, once they did the 60-year study, come out at 14 years less. However, due to all the wonderful medications, people getting the information, like Stuart was talking about tonight, and being more aggressive with their care, it's actually lowered to 7 to 9 years less, which, like they have said, the years that they're quoting, for women, 77.2. For general population, it is 81.8. But that's not that far apart. For men, it's 72.4 years, and as he said, unfortunately for PPMS, the mortality is higher. But it's not that high, 71.4 years. So although it sounds, read the actual numbers, the news is really good. It's actually not as scary, as you might think. And it's getting better. it is getting better. And as Stuart said, it is not time to give up, and it is not time to lay down and go, oh, no, this is a death sentence. Like they said, you can pass away from MS. You can. It's just like with cancer. If you have cancer that, have a brain tumor that damages part of your brain and you pass away from that. If you have MS and it damages, part of your brain that controls your breathing and your organs, you can die from that. However, as you see from these numbers, there might be secondary infections involved in the lower end of the scale. There might be organ damage in the higher end of the scale. However, we are living a very long life, not a normal life expectancy as far as general population goes. However, we can live a purposeful life. So, like Stuart said, let's make the most of it. And let's stay on top of our care and be our best care advocate. So that was a really good question. Okay, let's see what else is coming in here. It really was. So thank you to whoever submitted that one. We have one coming in off of social media, hashtag #AskMS&Me. I seem to get like sensory overload. Like, for example, Facebook with all these beeps and different notification beeps. I also get this going into shopping centers with all of the bright lights and the bling. It makes my head dizzy. I do suffer with anxiety. It makes me feel very anxious, and it just, none of this makes sense. Okay, so what they're experiencing seems to be sensory overload. Definitely speak to your physician about that, because there are things they can explain to you about that and ways we can cope. I have it myself. When we get surrounded by too much noise, exposed to too many visual stimuli, or put in new or loud environments, many people with MS experience the confusion, the fatigue, pain, and sometimes sensory overload is related to myoclonus. It's a stimulus-sensitive symptom that can, it can involve even jerking, involuntary motion. So most important is to monitor your fatigue and stress. Those seem to be the big triggers. I know they are with me. It makes most of us vulnerable to that overstimuli. I notice when I'm in the room with my children, my boys are very loud. They're being loud, they're trying to talk to me and be loud, playing their video games. And then let's just say the TV's on at the same time, and then my mom comes in and tries to ask me a question. Well, forget it. I did all of that input at once.
I get at family gatherings.
Yes, a family gathering, social. Yes, it can be a problem. You sometimes actually have to excuse yourself. Close family and friends will understand, and then you just go take a break and then come back into the situation. I know sometimes if I concentrate on one thing and kind of block out everything else that's going on, I'll even close my eyes, kind of put my hand over my eyes. I have one hand that works. The other one doesn't quite, but I have one hand that works, and I'll get in my eyes and that I have a headache or something. But I'm actually blocking out visual stimulation so I can handle the verbals that's coming in at me at the time. Some people get a physical reaction to the overstimulation, like I was saying, the monoclonus. I mean, there are people living with who've had physical stimulation at a massage or an adjustment, and they've actually went into jerks. And it's just when I get my hair done, I have to be careful, because if they're playing with my hair, my neck, adjusting and tugging on my hair, or even when I'm having my hair washed in the sink, my legs and I'm a quad, so they don't move very often, but they'll actually jerk up and down. But my hair's aware of that. So I just aware. If someone is going to be overstimulating me physically and I'm going to have a reaction, I just make them aware ahead of time, and we're fine. We just know, and just keep going with life and keep getting your hair done. We have another question coming in.
I've never, let me add a little bit. I never thought about it this way, but I'm a diabetic and taking my blood. There's some days when I do the thing, it hurts so bad. I want to crawl through the ceiling. And then other days I don't feel a thing.
Yeah, it's just those nerves and just a sensory reaction, and it's like phantom pain, and we just don't even realize why it's being triggered off like that. Okay, is anything else coming in, Ted?
Yes, we got another one from the hub.
Okay.
Thank goodness. Thank goodness the doc pulled me off of the prednisone pills, because they were doing more harm than good. I'm going down fast. Now, does anyone know how long it takes for the nasty side effects to wear off. This one, I just did a little bit of research on it.
Okay.
See, the effects of prednisone should wear off in about 7 days after the last dose. Every person metabolizes the medication differently, so it could give or take the length of time it takes to diminish the side effects.
Okay.
And that is generally for people who've only been on a short period of time, like 5 days or so. If you're long-term taking it and coming off of it, that's enough. Also wanted to note while I was researching that you don't want to come off your prednisone just suddenly. You want to gradually, because there is you can have a what do you call it?
You can have major side effects from just coming off that quickly.
Yeah, withdrawal.
Yeah, withdrawal symptoms. Yeah. Your adrenal glands have to go back to normal function as well. So it can be hard on some people. Not everyone reacts to the prednisone, Polymedrol, any of it the same way, whether oral or the IV steroid. People react differently. Some people have a bad reaction. They are allergic. So everyone has a different. To some people, it's what maintains their sight. It is what keeps them from becoming paralyzed. It can be a really function-saving medication. Your eyesight. If you're having an attack of optic neuritis, it can make a major difference in outcome. But then for others, they have a reaction. People have to only have Actar gel. Those injections. So there are options out there. If you're having those reactions, immediately notify your physician, of course, and then don't just stop, follow their direction. If they're telling you to suddenly stop. Do exactly what they say. If they're telling you to taper off, then you make sure you taper off. Because that means in your case for that, dosage, then you would have had withdrawal symptoms if you did not follow their instructions. So it can be serious if we don't listen to our physicians on that. Okay, let's see if anything has come in the car. Oh, here's another one from the hub. Hi, just if having recurrent bladder infections while on DMD drugs will shorten your life. I feel like I'm dying every time I get an infection. I get very weak, no energy, and can't function much. Okay. Well, urinary tract infections are UTIs. You'll hear us call them UTIs. It's an infection of the urinary tract. The urinary tract includes your kidneys, your bladder, your urethra. I've had my urethra stretched, actually, because of recurrent urinary tract infections, and it did help that situation. Symptoms, burning sensation, pain when you urinate, feeling like you need to go urinate more often than usual, that urge, to urinate and then you can't. You just leak a little urine. When your urine's like cloudy, dark, smelly, and absolutely if you see any blood. So, you want to report that to your physician right away. Severe recurrent UTIs could possibly cause kidney damage. I've had my kidneys fail more than once. I have kidney disease, so I understand this question. However, it's important to catch it early. Avoid sepsis and look for those signs. It won't necessarily shorten your life unless you're fighting severe kidney disease and not able to get, a transplant or something if you have no kidney function or if dialysis doesn't work in your case. But in most cases of bladder infections where it does not go to the point of damaging your kidneys, I would say in my personal opinion, I have never heard of it shortening people's lives just from the bladder infections. Have you, Ted?
No, I've never heard any about deaths or anything. Is there anything that anybody can do to lessen the chances of getting a UTI?
Yeah, UTIs, bringing those to your attention if you have the nerve damage where you're not emptying completely. Emptying completely is very important. Some people have to self-cath. So that people are scared of that it can be, really, really life-changing for some people. There are ways to actually express the urine completely that we talk about in our severely advanced groups or in our men's and women's group when we don't have others around, the ladies group. But there are things you can do to make sure you're completely emptying and speak to your doctor about that. They can help you. Also, many people swear by natural methods of helping clear the kidney infections, which we've all know about the the drinking cranberry juice or taking cranberry. So we've all heard those. My mom, she's from the mountains of West Virginia. We used to do a parsley tea cleanse, and we brought that to our doctor. That was safe in our case, and the nurse practitioner actually wrote down the recipe and the regimen we were using and used for her mother who had severe kidney disease, and it actually helped her improve. So we're like, hey, this worked. We were excited about that, to know that it wasn't just a old mountain wives' tale. It actually was based in some kind of science, flushing out the kidney. So that was well. But your doctor can help you plenty of ways to prevent those recurrent UTIs. Being vigilant is really, really important, though. Okay, Ted, is there anything else coming in?
Yes, we do. There's another one from the hub.
Okay.
Quick question. I had to have Kenalog injections from my rheumatologist last week, and cortisone 1 into my shoulder. I'm also getting another Kenalog tomorrow, and an epidural in my back for psoriatic arthritis.
Oh, psoriatic arthritis, yeah.
My neurologist ordered brain and cervical spine MRIs with contrast in July. Will the steroids affect the MRI results that you think? What do you think?
Oh, that's a good question. A lot of people, okay, if I have the steroid injections, does it affect my MRI then?
Yes, that is a very good question. Steroids themselves don't heal lesions, and even if they did, it wouldn't happen overnight. 150 milligrams of prednisone can mitigate the allergic reactions, but isn't strong enough to influence the influence on the central nervous system lesions.
Yeah.
At best, steroids might have a small influence on many, in much of the dye, in the way the lesions absorb the dye. But not enough to not be able to, doctor's results. Lesions are still going to show up on our MRI. If steroids did get rid of lesions that great, everybody would be on steroids.
Yeah, that's all we would need, right? Get rid of our lesions with just the steroids. Unfortunately, DPMSers can tell you that's not the case, but they do help stop. When we're having a relapse, they stop some of the activity and inflammation. So they do help greatly, like I said, prevent some damage, but of course they're not just going to get rid of all of our lesions. We stay on our disease-modifying therapies or other therapies that you're choosing natural to try to reduce those lesions and the activity. But unfortunately, nothing just, is a magic solution to get rid of all them and heal all them. Yeah, nothing magically heals everything. However, some of the new are getting results that are quantified as no disease activity, literally no disease activity, like with Ocrevus and some of the new trials in Lemtrada. There are some patients, at certain levels of progression that are seeing no level of disease activity for several years. Is that a cure? No. But we will take it for now and pray for more. Yes. So we hope more treatments are coming down the pike for us. So that's really great. No, but that's really good. That I'm sure their neuro can explain it more, but it won't, preclude. If their neurologist knows everything that's going on in with your other doctors, and he should know whether or not this will work or not. Yeah, that's true. Yeah, so they can still, most likely, of course, your neuro will give the final word, but they will most likely be able to go through with their imaging. Okay, let's get another one off of here. The Info Hub. Okay, I have no idea how my hands got swollen and hot. Went to lay down. The back of my legs were not feeling right. Now my neck is hurting and a headache. Any of the MS people have this at any time. What can I do? Okay, let's see. First of all, it seems like all of these could be new or worsening issues for you, not knowing your case personally. But I would advise you contact your neurologist and primary care team ASAP. Any new or worsening symptoms that last more than 24 hours, if it's been longer than 30 days since your last relapse, you should put in a call to your care team. That's what I do personally. Swollen hands or feet can be from several conditions outside of MS. That's why I said your primary care team as well. With MS, your lymphatic issue. Due to our lack of mobility and blood flow, we can develop lymphedema or lymphatic issues with the blood flow. We can get that temporary swelling, and I've had it in my hand, so that's not uncommon, especially when we travel or overdo it, or if we have activity going on that is affecting one limb. So the blood flow and the inflammation is affecting that limb. It can happen. A pseudo-exacerbation could cause the rest of the issues you're describing. However, a medical professional would have to rule out other root causes. Certain DMDs can cause temporary flu-like symptoms, so there could be a lot of root causes there. There is, a disorder with MS. You've probably read the side effects, where our skin does feel hot. It feels hot sometimes. Mine feels like it's on fire sometimes, especially when I'm on steroids. It's even worse. So there are many, including our medications, that can cause those issues. So I would definitely, if that's new, like I said, or worsening for more than 24 hours, just give your care team a call because, yes, it can be MS-related possibly. Okay, Ted, anything else that has come in?
Actually, the next question actually kind of works with what you were talking towards the end of that last one. This one's from the Hub. I would like to ask the question of, can you have a relapse a few weeks from your last one? I had steroids and an MRI and will be starting new meds soon as approved. I did look this up to see if there was anything, and everything that I found says the same thing. I'll give you the description of from the Mayo Clinic. An expiration of MS, also known as a relapse, attack, or a flare-up, causes new symptoms or worsening of old symptoms. To be a true expiration, the attack must last at least 24 hours and be separated from a previous attack by at least 30 days. More expirations will last from a few days to several weeks to even months. But what you might be experiencing is a pseudo-expiration, an MS flare-up of symptoms that have been experienced before, and they are usually only last for 24 hours. Unlike a relapse, pseudo-expiration are not a worsening of the disease. They're just related to inflammation brought on by a fever or heat source. Many things can trigger a pseudo-aspiration, but it's not a real relapse.
Yeah, I've had many exacerbations. Exacerbation can, like you said, be brought on by so many things. Our activity, stress, environment, eating, causing inflammation in our body. It can be even if the steroids have calmed down, a lesion can even be inactive from your DMDs. You still have the scars there, and there can be activity just around the edge, So you can have things going on in your body at all times, and things ebb and flow. So everything we have is not an actual relapse every time we have activity. So it's definitely any time, use that rule, call your physician, because it's only a medical professional can determine. We can all check with each other all we want, but not knowing one's comorbidities and everything they're experiencing, we don't know if they have other infection in their body driving it. You could have a UTI. It can be flaring things up. So definitely, like Ted said, give them a call because it can happen. Okay, anything else coming over?
Yes, there's another one from the Hub. I was busy this
and my hub's really busy tonight. Just in case somebody doesn't know what we're talking about, the Hub is kind of our nickname for our MS&Me Info Hub. It's on Facebook. So if you guys want to join in the fun, it's our general information hub where our listeners from around the world, we're listened to, followed by about 37 countries at this point, and they can all, listeners from around the world, male and female, get in that info hub and chat. We also have former guests in there that drop by. The professionals who we've had on the show, different patients will come by and update us, share their videos, share their latest projects, their books, their websites like Stuart. So join in the fun on the MS&Me Info Hub there on Facebook, if you're on Facebook. Go ahead, Ted. Sorry, I just wanted to throw that in, confusing anyone.
Nope, that's a good plug. Let's see here. Let's see here. Is the numb and tingling leg that they are referring to as nerve pain? I am taking gabapentin for nerve pain, but I am in a lot of pain in a lot of places, but have some bad experiences with painkillers and don't want to take them.
Oh, okay. Good question. Yeah, that's a hard one.
I deal with a lot of numb tingling. That's kind of what sent me to the doctor to get my diagnosis. But
yeah, I've dealt with a lot of that myself. I'm on the GABA as well, just that whoever posted that was. That's hard, but there are other choices. Ted, would you like to take this one since you had that as your first symptom?
Yeah. Numbness, tingling, and burning pains are most common MSers suffer, and considered and is considered nerve pain. If gabapentin isn't working for you, you can try asking your doctor to either change the dosage or try to switch you over to something like Lyrica. You can also talk to your doctor about maybe antidepressants have also been used for nerve pain. If sensory symptoms are due to relapse or a new MS attack, steroids may also help control them. You can also try a topical capsaicin.
Oh, the capsaicin. Yeah, the capsaicin. It's called capsaicin, I think.
Creams or ointments. That chemical is what's found in hot peppers. That's what makes them. And it triggers your nerves to change what they're doing, how they're feeling. So my brother uses.
Does he? Yeah, that kind of nerve pain. Yeah, that's definitely. But there's all kinds of options, as Ted said. So definitely speak to your physician about that. There are other options. Unfortunately, we sometimes confuse our pain as being all nerve pain, and sometimes it is musculoskeletal involved. Sometimes you will need additional treatments for that. Can't take the pain medication. That's very hard. But sometimes if you control the spasticity, if you control spasms, if you take things like I added, of course, my muscle relaxer, my Tegretol, there's other things. There's some natural treatments for spasticity and muscle spasms. So there are other ways to combat that pain because there are many different types of pain that you might be feeling with that, along with that nerve pain. Okay, let's see what else we got. Oh, a different group. We have one from our severely advanced group. That is from Facebook. What is stage or stage 4 MS? That is a good question. This confuses a lot of people because that can be a scary word. When somebody says severely advanced or in-stage MS, that can sometimes be misunderstood. I am actually, in stage myself. So let's just get through. In stage or severely advanced is when a patient's reached a stage of progression, considered over like 8.0 on the EDSS scale. Basically, when you require 24-hour care, you are considered severely advanced. Now, although it sounds scary or like death is near, like, in-stage cancer, we start thinking, oh, no, that's like stage 5 cancer and somebody's going to pass away. That is not necessarily for us. Although people can pass from MS, patients who are considered in stage can live for many, many, many years, okay, at this stage. They can have productive life. I've been in stage myself for over a year, still living, as y'all can hear, a very productive life. I require lots of care and assistance. Thank you, Ted. With lots of assistance, with a big care team, and with my friends like Ted to keep me going through the rough patches, that you can live a productive life when you're quadriplegic, when you're bedbound. If you are able to get out in your high-end power wheelchair with your care team. Think of our friends who are in the media, like Jason. I mean, Jason he just amazes me. Look at his access map and with his documentaries, and oh my gosh, he lives such a productive life, yet be considered in stage multiple sclerosis. So no, we don't think of it, even though that's technically what they call it. It's just a name. It's harder. It's more difficult to do some things. We have to find different ways to do some things, and sometimes with assistance, but yes, it can be a productive part of life. Actually, it looks like the one that comes in next is kind of related a little bit to that stage, so I guess I'll read it too if you don't mind, Ted. It's the one coming in from Progressive. Can I take that one? Okay. We have one Progressive group. That is our Facebook group that is for PPMS or SPMS, so people who have transitioned or are transitioning to secondary progressive, or those who have lived with primary progressive, both active and inactive, okay? Mine is active, so I'm in that group as well. We get choked up from food or drink going down bad. Does it seem to seize up your entire chest and all the way down it's like a hug. And it takes a bit to get over the pain, just a strange symptom, and I wonder if anyone else has had similar symptoms. Yes, I actually have it. Being a quadriplegic and being more advanced, I have definitely had my share of this. What it is, speaking with my physician, and you'll have to speak with yours to make sure, but what my speech therapist and my physicians have worked together to explain, it's all part of my esophageal spasms. We can get muscle spasms anywhere there's a muscle. Just like with the hug, where we get the spasms in the little muscles, intercostal muscles between our ribs, we can experience those kind of muscle spasms anywhere in our body there's a muscle, where there's nerve damage and it's triggering that spasm. So unfortunately, we can get that damage, going down the center line of our body, and we can have esophageal damage, nerve damage. I have nerve damage in my stomach as well called gastroparesis. But I can also have the esophageal spasms, and yeah, it just feels like a giant hug, and everything seizes up, and you can't swallow right. And I think that the choking mechanism with that sensory thing will trigger it sometimes. Other things can trigger it for me. Just taking a deep breath weird sometimes and talking too much will start the spasms when my throat gets dry, and I'll have to drink. Cold liquids. For me, I don't know if it works for anyone else, but cold liquids seems to calm down my esophageal spasms. So I don't know if that would help everyone, but it just seems to work in my case. So I don't know if you use that, Ted, but I've definitely experienced it.
Just occasionally, it just feels like you're swallowing something thick, but when you're not, don't have anything, and you're not really swallowing anything, it just feels like there's something there. I get that sometimes.
Yeah, and if you're getting choked, some people I know choking on air we can't do much about, and the spasm triggered. But if you're choking a lot on liquids, a lot of us, when we start getting that esophageal damage, we will we'll get choked on thin liquids as well. There are food thickeners. So you can look for that on Amazon, or so there are food thickeners that can help. If you just give a little more texture to those thin liquids, we don't seem to choke on them as much. You can speak to your speech therapist about that as well. They will definitely help you with those issues. All right, Ted, what else is coming in tonight?
Let's see here. We have another one from our progressive group.
Oh, okay.
This may be a vague question, but what signs and symptoms have you noticed that clue you into your disease progression? Okay. All right. So just in general, how do we are personally progressing? How would a person know that? Well, I think become progressive, you kind of, get a clue to that. You really start noticing that it doesn't come all at once. There are no types that it's just like, boom. Usually there's for PPMS, it's slow progression, slow, steady, constant progression. So unless you've got the active form, which is rare like mine, you're just having that constant, you will get new symptoms, but your everyday symptoms just slowly get worse. There are ways to control them, of course, but to help, but they slowly get worse. So it's new or existing that's slowly getting worse. With SPMS, that's different. Of course, you're transitioning from the more active form of the disease, where you're having relapses, into the less active and steadier progression form of the disease. So slowly you transition in from those ebbs and flows, those ups and downs, back to your sometimes to your more baseline, your new normal sometimes with a bad relapse. You transition to having those slower, steadier intensification of your symptoms and
progression as of worsening of your disability level. So, you will notice you can't do as much physically as you used to do. You cannot balance as much as you used to balance. You'll have to really listen about this one. They can explain that transition into progression. But does it seem to happen like, every day I'm getting worse every single second of the day? No, it doesn't really feel like it rarely feels like that. Yeah, it rarely feels like that. Luckily, most of us don't have. Yeah, go ahead, Ted.
For me, it's when something that a symptom that comes and goes, and then you realize one day you wake up like, it didn't go away, and it's not something that it's just you realize it after some time that it hasn't gone away in a while.
Yeah, it's not. Most of them aren't severe. So they're like, hello, you really works. Most of them aren't that way, as when we would have, relapse events and have those major attacks where, we'd have sudden progression. It's a little different than that. Now, there are aggressives of the disease where it does come on a little more aggressive even through the end progression. However, for me, it's, I'm not moving that hand as much as I used to. Oh, that's new. Or, it's getting worse. I'm dropping things more often. So it's like that. It's not, where you're having just debilitating constant effect on your life where it's all you think about. You kind of just, you get that. It's just there, and you just go on with your day, and it doesn't make it a little harder, yes, but you find another way to do things. So it's definitely not an end-of-the-road thing for us. We just we got a lot of adjustment sometimes, but we keep going. Keep going. All right, anything else coming in, Ted, for social media? I think I saw one pop up from Ask MS&Me.
Yes, from the Twitter. Do you get cramps in your upper arms?
Good one. Do you get those?
I don't get cramps in my upper arms, but I get cramps in other areas. I don't, other than things like staying hydrated, eat foods rich in potassium and magnesium, stretching exercises, massages. If it's really, really bad, maybe talk to your doctor about getting on muscle relaxers.
Yes. I do get cramps in my upper arms. I believe, in my neck. I think wherever you're having the nerve damage that affects that muscle group, you can have, a cramp there. My therapist, when I was doing exercises for it, used to put BioFreeze. If the cramps got really intense, they would use BioFreeze during my therapy. But like he said, the staying hydrated is a big one. Muscle cramps can get worse if you're heat, sensitive, and even ambient heat in the room can make a difference. Stress is a huge one, we know, for muscle tensing. So stretching exercises, mindfulness, there's natural things, like you said, with potassium and magnesium, or there are medications to help with those. And who doesn't like a massage? I like that, Ted, the massager. That was a good question. Okay, looks like we got another one from Twitter, just popped up. What does optic neuritis look like? Is it painful, and does it affect colors? Ooh, very good one. I know I have optic neuritis. Do you have optic neuritis, Ted?
No, fortunately I haven't had that one yet.
That's very fortunate. Sometimes that patient's first actual presentation is with optic neuritis. Patients experience it. Well, I know I do. They might experience, like I do, the double or milky vision, that double blurry vision. I always say it's milky. Others see it like through lace curtains, like a lace curtain just comes down over their eyes. Some people see flashes. Eye pain. I do eye pain, especially when I move my eyes around. When it's even flaring and it's not an actual total attack, I'll experience that as well. Color. Yes, actually, I've been left with some color dullness from some of where I've lost total vision more than once. The red test is a really good one I like to tell everybody about. My son, who's 7 years old, actually had his first optic neuritis attack, and I monitor him. When he seems to have symptoms for another one, I monitor him with the red test. My doctor taught me that one. You take a really intensely red object. You close one eye, put your hand over one eye, and look at that object, that red object with that one eye. Okay, now you uncover that eye, cover up the other one very well, stare at that same object. Is there a difference in the intensity of that red? That's a very good indicator. If it looks orange or less red or different in any way, you need to have an eye exam by an eye doctor who can do the scan of your optic nerves. Let your neuro know that this is going on right away, because sometimes they will say, forget the eye doctor, go straight to the hospital for steroids. It just depends on your case, and if you've had recurrent attacks, or if this might be the first, you need that eye exam. But the eye and of your eye is very important for your treatment. My eye doctor printed out a report from several visits and over time, and he had found arterial sclerosis in one eye and optic neuritis in the other, and printed out a long report. He said, take this with you to the hospital. Make sure your doctor gets a copy of this as well, because it's kind of a roadmap to your disease right now. So optic scans can be very powerful and give them a very good view. Okay, so let's see. What's the next one? I hope that answered their question completely. Is there anything else coming in off of social media?
From ladies.
Okay.
We got a bunch coming in from ladies right now.
Okay.
Let's see some of those.
Ladies. Let's see, ladies. Okay. Has meds for MS after the age of 60? Well, I haven't gotten to that point, and I don't take medications because I'm PPMS. Have you heard of anybody, Ted, since you're more into the RRMS groups and all that, have you heard any stop taking their med, just stop taking it on doctor's direction after a certain age? Because of age, not because of progression.
No, I've never heard of anybody stopping. I've heard of people starting at that age but not stopping.
So I don't think it's age specific. Yeah, I think it would be progression specific. Like if you had lived so many years, transitioning into RRMS and you've transitioned into PPMS, and they're saying that at your level of progression and activity, your medications are no longer effective. So we're stopping keeping up your other medications. So I've heard of that, of no longer being effective at a certain stage of progression. Now, of course, we changed a little now that we can treat more SPMS and RRMS, like with Ocrevus and other things coming down the pike. There are medications approved for SPMS, and now there's medication even approved for PPMS. So I think things will change, protocols will change, and they might not be necessary after a certain level of activity has stopped, and that might be when the doctor says, okay, now you no longer need this disease-modifying therapy. We'll just put you on maintenance of your helping you with any symptoms you have. Yeah, any symptoms you might have. Okay, gosh, there are a lot. Okay, let's see. Let's get to another one. Has anyone had a baby while being diagnosed with MS? How was your pregnancy? Were there any complications? And were you a single parent or married? Wow, that's a big question. Lots of questions to that one. Okay, Ted, you take that one. We're pregnant. No, I'm kidding. I think I better take this one. Okay. If you don't mind. Okay, yes, I have had sir. Yes, I have had a baby, in fact, while being diagnosed with MS. I've had as well. That was more actually probably due to my lupus than MS. I've read study after study about being pregnant with MS, pregnancy with MS. MS itself, in all the studies published that I know of, have never the pregnancy. Like, it does not affect you having a healthy baby within of itself, the disease itself. Now, of course, other things, you might even have to stop your DMD, or they may even, change your choice of medications. Your other medications besides your DMD could even possibly have to be changed, especially when you're talking about breastfeeding after. Complications, not specifically from the MS. I did, however, we have comorbidity, and sometimes when people have complications, it's from other things they have wrong, that can affect your pregnancy. Were you a single parent or married? I was I had both of my children. He wasn't as much help at first, the daddy. Mommy did. It can be difficult because many of us go through a remission of any symptoms while we're pregnant, or at least most of our symptoms while we're pregnant. So it's glorious. Sometimes it's only, 1 or 2 trimesters of it that you go into to the remission, but it's wonderful. But then it can come back with, after birth. sometimes it takes a while for people's symptoms to come back, and they come back gradually. As they're breastfeeding less and less. It just seems to happen with some women. I don't know if it's hormonal. I'm not a doctor, but it just seems to come back, slower for some people. So that can affect your activity, new baby, and you're tired of recovering anyway, and now you got a new baby in MS and fatigue. So, yes, sometimes I do think we might need a little more help, from friends, family, and loved ones, at first, and maybe others. I've seen some that had no problem and just, handled it like a champ, but I guess we're all different. We have a snowflake disease, as they say. We just have different stages of progression when we get pregnant, and that can affect it. So, but I did okay. I did well. I went back to work after my maternity leave was over. That was hard, leaving the baby. But I were in capable hands. My mother did my child care after I went back to work. So I was lucky there. Not everyone has that luxury. There's wonderful nurseries, as y'all know. But, yeah, you can have a successful pregnancy, very closely monitored by your doctor. Keep them updated on everything that comes along. And I was monitored very well and had 2 pregnancies that were successful. So, yeah, it can happen. Like I said, though, you might, if you are seeing after birth, symptoms are returning and you're adjusting to that and the baby, you might want to have extra help around. I went and stayed at my parents' house. Even though I was married, we just went over there and stayed because I needed that extra help. So if you know that, don't be ashamed to say, hey, my friend, can I come stay at your house? So you might need, and you come stay with me. So you might need that extra assistance. But, yeah, many of us in the ladies group have had healthy, happy babies while we were fighting our. So, all right, let's see. Other ones from the ladies group. I had high risk PML. I was to stop to Sabri. Is there a safe med for me to switch to in that case? Well, it's very hard to answer that, without being a physician. I can answer it in a general way, I guess. Our MSR, that are at high risk of PML can safely switch from Tisabri to Lemtrada according to the recent study that was released. It was an Italian study. I don't remember all the facts from it, but you can speak with your doctor about it because that would be a safe choice. So just remembering that one Italian study, I would say ask about Lemtrada if you're switching from Tisabri and need another safe choice, because I remember that study did say that the study concluded it was a safe choice. So that's something, look into further yourself with your physician. But according to the study, that was the one. There's so many new ones. I would just definitely ask your doctor because of all the news coming down the pike. You just never know what it is. Okay, one more coming in from Ask MS&Me. How many on here suffer from gout? Is gout an MS, a symptom of MS? I don't suffer from gout. Ted, do you suffer from gout?
Yes, I do. Gout is first off, it's not a symptom of MS.
Okay, I was thinking that. Okay.
Gout is actually a form of arthritis. When your body doesn't process uric acid correctly anymore, it starts to crystallize and will lodge in joints. Typically, the first place it does is your big toe joint. It'll swell, turn red, feverish. Oh, my God, it feels like you have a broken foot.
Ouch. That does sound painful.
It does. Doctor will generally give you something like an anti-inflammatory. You've got to wait until and there is now medicine you can take to help your body process uric acid.
Okay, so they've developed that now.
Yeah, so there's a pill you can take daily, and it processes, helps you process your uric acid. Or if you just have acute flare-ups occasionally, and so you can just get anti-inflammatories for that. If they're not too bad, I've had it flare up bad enough where I thought and heavy anti-inflammatories take care.
That does sound familiar.
They had thought that there might be something because uric acid is an antioxidant. They've done studies to see if it would help people with MS. Something about high levels of uric acid are not, or people with MS have low uric acid levels. They thought maybe uric acid was.
So they tested that to see if that might be some kind of treatment for MS,
and it's
or related to it.
Yeah, but it hasn't panned out. And,
oh, okay. There are so many studies going on right now. It is really an amazing time for our community. Since this is the first show on our new network, and thank you all for listening tonight on MS&Me Radio Network, we are going to just want to share a little information about what we're doing here. We are going to be a 24-hour MS network dedicated completely to multiple sclerosis. We are going to have shows from physicians, from patients, from different clinicians, from people who serve the MS community, entertainment shows from people with MS. Ted's going to have his own show. He's a gamer, and he's going to have a show. What's the name of your show, Ted?
The Gamer's Hut.
The Gamer's Hut. Oh, my gosh, this will be fun. Okay, I'm listening to the Gamer's Hut, by the way. My sons will want to listen to the Gamer's Hut. They are big-time gamers. Yeah, so all you gamers out there, we have a new show coming. Dr. Boster has a new show, the MS specialist we had on last week. There are just so many people from the community. I cannot wait to hear them all. Dan and Jennifer Digman are going to have an amazing show. We're going to have a show from Anisha Hankins, from the Point of Veteran. There's just so many shows, fitness shows from our friend Trevor with the MS Gym, and hope to bring the nutritionist on. Just everybody is, and we will actually have a forum up on our website, www.msandmemedia.com. So msandmemedia.com. We'll have a form on there where you can actually submit your show ideas. So if you submit any ideas that we haven't received and we think we can make a show out of it here on MS&Me Media Network, Radio Network, we will get that show on the air. We're going to have 24 hours from around the globe. So anybody listening from around the globe, I know we have 37 countries out there listening now, you can submit your show ideas. We want the variety. We want the whole MS community to be heard and have a 4-hour platform. The shows at first will be 30 minutes in length. So our show will, once all of our book shows are completed, we will be eventually going down to the hour-long platform that you all love. So we will still have MS&Me, Ask MS&Me, though. You guys, I know you want that, and you want to ask your questions, and you want to have the featured guest. So we will still be doing that platform for you. Now, if you have any questions, go ahead and submit that to us. We love your questions on hashtag MS&Me. You can do that on any of our social media. We're on Twitter. We're on Instagram at ME Radio. We are also on Facebook, as we mentioned with the groups tonight. We have a main radio network page on there. That's MS&Me Media. You can search for that. We have the Info Hub that we mentioned so many times tonight. So you can still see all of the radio information on there and interact with past and future guests. And they all get involved and communicate with you on there as well. That way you can ask questions, submit questions on there. It'll be great. It'll be more interactive for all of you to our community. With all the change we have and with our parent company, the MS Global Support Network, our goal more of this outreach that Stuart was talking about tonight. It's supporting all of these great organizations out there like MSU News, like the MS, National MS Society, like MS Association of America, like all of them, over in MS UK. I mean, oh my gosh, so many good organizations around the world. Well, I was just chatting with the guys at MS Translate over in Australia, and there's just so many of us around the world that if we all come together and support the information and support and get all of these out there and let people know what services everyone has, what a better supported and educated community we will have. Well, Ted, I thank you for being my sidekick tonight. I really appreciate it.
I had fun.